Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to give you guys an update on COVID-19. We're starting to understand more about how COVID-19, or SARS-CoV-2, the virus that causes COVID-19, is transmitted from one person to the next. It seems so obvious and seems like we should already know how that happens, but this virus has been a little bit unexpected. We think for the most part that this virus is spread mainly through large respiratory droplets that land on your eyes, nose, or in your mouth when another person is sneezing, coughing, or speaking. However, we're learning a little bit more about aerosolized particles and how important they are in transmission as well. Aerosolized particles are much smaller than the large respiratory droplets that we have usually with speaking, but aerosolized particles can be emitted when we cough or sneeze, and they linger in the air for some time. We think that when these are inhaled and go into the lungs, that is another possible way that you can contract COVID-19. We don't think people are getting COVID-19 as much through surfaces, meaning that if someone coughs or sneezes and then touches a doorknob, and then you come after and touch that doorknob, it's not as likely that that's how people are getting COVID-19, although I still would recommend cleaning of high contact surfaces multiple times a day if possible. The next big item in the news is the resurgence of cases in certain states. I have some friends ask me, is there really a resurgence? Well, it really depends on which state you live in. In my state of Texas, the answer is yes. I think a good data point to use is the number of hospitalizations, not just the number of positive cases. Let's look at that data together, and I do want to say that even though I'm showing you data just for Texas, this data is relatively easy to find on the internet. So when we look at this first graph, this is the total number of COVID-19 hospitalizations in the state of Texas. I've been following this from day to day, and it's increasing. There's other information here too about available hospital beds and ventilators. I wouldn't worry so much about that. I would just focus on the overall look of the graph and notice that the lines are increasing in size, which means that the number of hospitalizations in Texas are increasing. I've also had people say, I don't really think we're having a resurgence, we're just testing more people. Well, if that were true and the virus was remaining stable in the community, if we were increasing the number of people that we were testing, the number of positives would actually be going down. And this is what we're seeing in states like New York. We're seeing that their positivity rate has gone down significantly. However, as we're testing more in Texas, we're finding that the number is increasing, which is concerning. This graph is from the COVID-19 tracking project from Johns Hopkins University and is available to everyone on the internet. I'll put a link in my description. So as this chart shows, you can see that I highlighted that bottom right-hand portion of the graph that shows that positives, a 7-day moving average is 11%. And even though we're testing more people, we're finding more positives, which is concerning. Now let's compare this same graph to what's happening in Connecticut. I just randomly chose another state where I know the coronavirus is decreasing. As we look at the state of Connecticut for the same day, we see that despite an increase in testing, their positivity rate has gone down. And it shows that the positives, a 7-day moving average in Connecticut, is only 1.3%. I encourage everyone to go onto the Johns Hopkins website and find the information for their particular state. We're continuing to learn more about the people that are dying from COVID-19, and there's a really good graph on worldometers. Once again, I'll put a link in my description. Let's go over this table together. So as we see in this chart, this is data that's been collected from the New York City Health Department as of May 13th, 2020. Of course, you could say, okay, well, that's only New York City, but I think for the most part, this is generalizable data for the United States. And we can see on the left-hand side is age. It goes from age 0 to 75 and older. And you can see the significant increase in the share of deaths as you age. So the death rate of persons less than 18 years old is very, very low, 0.06%. And when you go down the table, you see that older people greater than 75 years old comprise about 49%. And the underlying conditions in this table included diabetes, lung disease, cancer, immunodeficiency, heart disease, hypertension, asthma, kidney disease, and gastrointestinal or liver disease. Another interesting graph from Worldometers is that even though in the world COVID-19 cases are increasing, in general, we find that the deaths are decreasing. Well, why might this be? There are a couple of theories that may help explain this data. One is that we think that we have better treatments now. We're also seeing younger patients that are becoming infected with COVID-19, and that may be happening because older adults are sheltering in place. This also just may simply be that the data is lagging behind, and as we continue to go forward, the deaths may increase, but I hope that's not true. My last update is that treatments are becoming more solidified for patients that are hospitalized for COVID-19. Oxygen continues to be the mainstay of treatment, either through nasal cannula, BiPAP, or intubation. Remdesivir, which is an IV medication that's been studied in a randomized controlled trial and mentioned in a previous video, is used for moderate to severe COVID-19 patients and has been shown to improve recovery time for patients with COVID-19. We're not really sure if it helps with mortality or not. The data is still coming in on that. I think the most exciting update in treatments is regarding dexamethasone. Dexamethasone is an IV or oral steroid. It's very inexpensive and it's been around for a very long time and has a really good side effect profile, meaning that there are minimal side effects, especially in short-term use. A recent trial called Recovery showed that giving 6 milligrams of dexamethasone to patients that were on oxygen improved greatly when they received dexamethasone. In fact, it reduced deaths by 1/3 in patients that were on a ventilator and reduced deaths by 1/5 in patients receiving oxygen only and were not on a ventilator. It was shown to be of no benefit in patients with mild COVID-19 symptoms and were not on oxygen. Hydroxychloroquine continues to fall out of favor. There just hasn't been really good data, and we continue to have concerns about heart arrhythmias on this medication. And lastly, something that's so simple has been shown to be very beneficial for patients that are in the hospital. It's something called pronating. Pronating means putting a patient on their stomach. Now, why would this be beneficial? Well, there are a few things that we think are the reasons why pronating has been so beneficial with COVID-19 patients. The first is that the large majority of the lung volume is posteriorly, meaning towards your back. And as patients with COVID-19 continue to worsen, we see more and more fluid buildup and something called atelectasis, which is microcompression of the lung that doesn't allow aeration of the lung. So even though there's blood flow to this part of the lung, oxygenation transfer is not occurring. Turning someone over on their stomach allows more oxygen to flow to areas of the lung that are already better aerated and helps to drain those posterior portions of the lung that may be collecting fluid. It's a really exciting thing that's being used in the hospital with really good results. At the end of the day, I do want to continue to stress social distancing and washing your hands. Thanks again for joining me.